bagi tahu aku betul apa.
Drink.
There is so much suicide cases recently, right? But I heard she mentioned about MDD. What is that? You guys know?
I think MDD stands for Major Depressive Disorder, right now?
Yeah, I think so. But actually, I don't understand. How does the person suffer?
I have read somewhere and found the videos about MDD. I think we should watch the detail at home. I think so.
Yeah, I think we should find the video and get to know about what are the treatment or what are the causes. Or maybe we can understand more in detail so that we can help those in need. Yeah.
True.
Because MDD is so new. Like every day we heard a suicide or a person having a depression and so on, right?
Yeah.
Okay, so let's go home and we try to find the video so we can understand better. Let's go.
Come on guys, let's watch this. I had found MDD video. Let's watch it together.
This is the introduction of Major Depression Disorder, MDD. Major Depressive Disorder, MDD, is a debilitating disease that characterized by at least one separated episode of depression and that lasting for at least 2 weeks, involving in clear changing in moods, interests, pleasure, cognitive, and also fatal changes. Symptoms of MDD is inflated self-esteem, decrease of need of sleep, increase of speech, flight of thoughts, distraction, increase of goal-directed task activity, and engagement in dangerous behavior. There are 3 factors of depressions. The first one is life event, the second one is changing in the brain, and the third one is the personal factor. The first factor of depression is the life event. Unexpected life event can be a risk factor to cause a depression. For example, long-term unemployment, living in abusive relationship, and also loneliness. The second factor of depression is the changing in the brain, the cognitive impairment or imbalance that happen inside the brain. The third factor of depression is personal factor. The first one is family history. Genetic factor is because of the increase in risk factor that genetic can run in their families. The second one is Personality. Some people tend to have low self-esteem, perfectionist, or had too much negative thoughts. Their behavior will turn into depression. The third one is medical illness. The stress and worry of coping with the serious illness can lead to depression. And the last one is alcohol and drug use. They use drugs to cope with their stress and lead to addictions. The addiction can cause a depression, especially with a long-term management or the chronic pain.
For the treatments of major depressive disorder, first we have the psychotherapeutic intervention, for example, the cognitive behavioral therapy. Cognitive behavioral therapy focuses on changing the automatic negative thoughts that can contribute to and worsen our emotional difficulties, depression, and also anxiety. Okay, so next we also have the electroconvulsive therapy. It is medical treatment that most commonly used in patients with severe major depression disorder or bipolar disorder. ECT involves a brief electrical stimulation of the brain while the patient is under anesthesia. Lastly, we have the medications such as the antidepressant, the selective serotonin reuptake inhibitors, and also the serotonin norepinephrine reuptake inhibitors.
So this is the infographic of depression. The depression diagnosis has increased about 33% since 2013, especially among teens and millennials. There are about 63% teens and 47% millennials that are recorded to be suffering from depression. And women is 2 times most likely to be diagnosed to suffer from depression compared to men. People that are diagnosed with depression are 2 times most likely to suffer from one chronic disease, and 3 times more likely to suffer from a pain-related disorder, and 7 times most likely to suffer from alcohol or substance use disorder, which can lead to a loss of nearly 10 years of healthy life.